All right, so this is the next lab in this unit is going to be the respiratory system, and we're going to just start the beginning of the digestive system. So that's why we're going to call it Digestive System 1. So we'll finish the digestive system next week in the next lab. So what are some of these structures that we will be talking about? So the nasal cavity we've talked about before, and that's the entrance to the respiratory system. Pharynx is probably a new term, but just think throat. So kind of the back of the nasal cavity, the back of the oral cavity, and right before you swallow, and the opening to the trachea. So that's considered all the pharynx. So we'll talk about the pharynx in the different sections. And the next structure is going to be the larynx, which is the opening into the trachea. The larynx, think kind of voice box, right? It's going to be the one that's going to make up the noises and sounds with our vocal cords. So we'll talk a bit about that. Don't worry too much about the uvula yet. I'll show you that on the picture, but essentially it helps to close the back of the nasal cavity when we swallow. And then there's another structure that's part of the larynx that closes off the trachea when we swallow, because the trachea is the tube that goes to our lungs versus the esophagus, which is the other tube in the back of the pharynx that goes to the stomach. And so we definitely don't want the food going down the trachea. And then the rest of the tube work, the trachea branches, and once it branches, we call them bronchi. So bronchi is plural, bronchus is singular. So we have two main bronchi, and then those are going to continue to branch into secondary and tertiary bronchi. You can also think of them as main bronchi, lobar, and segmental bronchi, but I like primary, secondary, and tertiary better, I think. And then, of course, the lungs, and we'll talk a little bit about some of the specific things about the lungs. So here's just a picture about the respiratory system and a couple of things so we can follow the pathway of air, going in through the nostrils, through the nasal cavity, through the back of the pharynx, so the throat, and then through the larynx, so pharynx to larynx, down the trachea, and then that trachea splits into these bronchi, so right and left primary bronchi, and then we continue into some secondary and tertiary bronchi. So you can see how they continue to branch. It kind of looks like a tree. So we'll talk about that as well. So here's our first model. This is our sagittal section through the head. So we looked at this model for some of the brain structures, but now we're going to look at the upper respiratory system. So the upper respiratory system is pretty much anything that doesn't involve the chest. So our nasal cavity, and then if we look way back at the back here, we have this kind of curvature of the back of the palate. So this whole region here is the palate, right? And then we have a region that's the hard palate, which is our bone, right? That the maxilla, the palatine process of the maxilla, and the palatine bone, if we remember back to our skull. And then we have a region of the soft palate. So this is all the soft palate, and that very bottom part is going to be the uvula. And essentially this flips upward and closes off the pathway to the nasal cavity when we swallow our food. And so this whole region, pretty much from the back of the nasal cavity, the oral cavity, and down into the larynx, which is these blue structures here. So these blue cartilaginous structures here make up the larynx, and this is all called the pharynx, all the back of the throat. Okay. And then the tube that runs through the larynx is the trachea. So here's just showing that here's the larynx. So all these blue, anything kind of light blue is cartilaginous structures. So the larynx is made up of multiple cartilages, and behind it is going to be the esophagus. So the tube going through the larynx is going to be the turns into the trachea, and then the tube behind the larynx that goes to the stomach is the esophagus. So this is our torso model, just showing parts of the respiratory system. So we can see the larynx, we can see one of those cartilages, specifically the thyroid cartilage, going and continuing as the trachea. You can see those blue rings of the trachea, those cartilaginous rings. And then we're going to split, and you can't really see it because it's behind the heart, but essentially they're going to split into the bronchi, and these white branch-like structures in the lungs are the bronchi. Those are probably the tertiary bronchi, once they kind of split a couple times from those main primary bronchi. So here's the model. We can see those bronchi because we've removed the heart. So the heart should sit right here, right? We said it sits kind of to the left, kind of pooches out that left lung. So, but if we take that out, we can see the trachea and where it branches into the main bronchi, or the primary bronchi. So the primary bronchi then branch into the secondary bronchi. So any branch off that primary bronchi is going to be a secondary. And those essentially go to the lung lobes. So there are different lobes of the lung, and each of those secondary bronchi are going to go to those lung lobes. And then they're going to continue out and continue to branch into the tertiary bronchi as well. Okay. And you can see the diaphragm. So the diaphragm here is what is going to delineate between the thoracic cavity and the abdominal cavity. And you see this tube that continues behind the trachea and behind the bronchi, and that's going to be the esophagus, because that's going to come into the stomach, which sits just below the diaphragm. Okay. So now we'll talk about those specific cartilages I was talking about earlier of the larynx. So the larynx is the opening into the trachea, and we have a couple of these cartilages, and there are quite a few of them, but we'll talk about the ones I want you to know. So the epiglottis is probably one of the most important ones for swallowing, and it is a soft cartilage. Remember way back when we were talking about our different types of cartilage, and we said we had an elastic cartilage that was super soft. It's in our ear, right? It allows our ear to be able to bend. Well, the epiglottis is also made up of that elastic cartilage, so it's able to flop over and cover the entrance of the trachea when we swallow. And I have a really good video of that in the lecture that I will link for you guys to show you some swallowing videos. It's pretty cool how the epiglottis is able to do that. And that's also what happens if you try to talk or laugh or breathe while you're swallowing. That epiglottis doesn't function quite correctly, and you get some liquid or food in your trachea and you start coughing. So then we have a couple more cartilages. The biggest is the thyroid cartilage. So the thyroid cartilage is a big shield-looking cartilage, and it's right behind the thyroid gland, which is why they're named that way. And then we have the cricoid cartilage, and it's a ring of cartilage, and it's essentially kind of like the first ring of the trachea. It's just a little bit larger. And then there's a ligament that joins the thyroid and cricoid cartilage. So don't worry too much about that yet. I'll show you that in the picture. But essentially it just joins the two cartilages. And then we have some structures that are actually going to be part of our voice box or vocal cords. And we have two different structures. And there's one we kind of call the true vocal cords and ones that are kind of the false vocal cords. So the vestibular folds are essentially just soft tissue, and they're the false vocal cords. So they just hold the vocal cords in place and tether them to the cartilaginous structures. But then we have the vocal folds or vocal cords themselves, and essentially those are what are going to be vibrating and creating the sound. So let's look at some pictures first. So I have those structures circled for you that I want you to know. So this is an anterior view at the top, so you're looking straight forward at it. So that big shield thyroid cartilage makes up the majority of the larynx. And then right below that you have the cricoid cartilage, which is kind of like a ring. And then there's a ligament that just connects those two cartilages together, which is that cricothyroid ligament. And then way up at the top, you notice this little lip-like structure or tongue-like structure, and that's the epiglottis. So I think the next view is better of the epiglottis. So if we look down, and this is the sagittal section, so essentially we cut through kind of midline, right? And we have a left and a right section. So we're looking at the left side on the interior side of that larynx. So we have the epiglottis up here. So see how it kind of folds up and protrudes upwards. And it's covered in some soft tissue, but essentially what happens is this can fold downwards like that and close this opening to the trachea. Okay, so it's like a little flap or a little doorway that can close when we swallow. So it's very handy and very necessary. And then we can look at some of these vocal cords or vocal folds. So essentially you notice we have two folds here. So there's a top one and a bottom one. So the top one essentially is just the vestibular fold, which is part of this soft tissue structure. And then we have the vocal fold or true vocal cords right below that, okay? And those are what are going to be creating the actual sound, okay? So this is a picture to actually show you kind of a schematic of the vocal cords, but also what it looks like if you actually look into the back of someone's throat. So that's the bottom pictures. These are actual pictures of the vocal cords themselves. And so if we look at the top picture first, we can see the schematic drawing. So if we find our thyroid and cricoid cartilages, that's these guys, okay, the big outer cartilaginous structures. And then we have those vocal ligaments. So they are ligamentous in structure, so they have some strength to them. So this is when they're closed on the left, and then they're open on the right, okay? So we can see how we can close and open the vocal cords so that the sound waves vibrate them as it goes by, okay? So if we look at our bottom picture, then we can see those vocal folds, and they're closed in the left and they're open in the right. So here are the vocal cords themselves, okay? And then at the top of the screen is actually the epiglottis, okay? This is the epiglottis here. So essentially the hole that's open is going to be the opening to the trachea. Okay, so this epiglottis can fold downwards and close that opening to the trachea. And the epiglottis sits on the anterior side. So the top part is the anterior side. So this is anterior, and this is posterior. So the anterior side has the epiglottis, and it sits there, and then it folds posteriorly when you swallow. Okay, and don't worry about these other cartilages. They essentially just anchor those vocal cords down, and they can move them and and they are just essentially helping with the sound, sound production and movement. So don't worry too much about those. I just want you to know the thyroid, cricoid, and epiglottis, okay, are three cartilages. So here's the model of the larynx. Okay, so we're looking at the anterior view again. Okay, and on the right side, we just have all kind of the soft tissue taken away. On the left side, you can see we have the thyroid gland and some of those pharyngeal muscles, laryngeal muscles here. So you can just see the two different sides, but that's okay. So up at the top, we have our epiglottis, kind of poking up behind the hyoid bone. And then we have that big thyroid cartilage and the smaller ring, the cricoid cartilage. And in between there, you can kind of see a little ligament here, and that's that cricothyroid ligament. Okay, and it continues as the trachea, right, down into the lungs. So if we go back to our sagittal view of our model, we can see some of those laryngeal structures. So here's the epiglottis coming up. So again, it's coming from the anterior side, and it's going to fold downward to the posterior side. And then here are our vocal folds. So here's the true vocal cords or vocal folds. And then up at the top part, this is the vestibular fold or false vocal cords. And then we can see the thyroid cartilage. It kind of wraps around to the backside as well. And then we can't see quite the cricoid cartilage underneath. So now let's look at some of the structures of the lungs that we want to know. So just like we talked about the heart, we've got an apex and a base, but now it kind of makes a little more sense in terms of the orientation of the lungs, because the apex is at the top, but again, think about an apex as coming to a point. So whichever the pointy end is, it's going to be the apex. And then the base is going to be the wide bottom part of the lungs toward the diaphragm. And then we do have a region, and this is a general term called a hilum. So we have a hilum in the kidney and in the ovary and some of these other organs in the body, but essentially it's just where all the blood vessels and nerves and everything are coming into the organ. So with the lung, we also have those bronchi coming in. So a hilum is just the area or the opening into the lung where all these blood vessels and nerves and bronchi come in. And then we have a left lung and a right lung, and then we have some lobes. And we have only two lobes on the left side, and if you can imagine why that is, so what sits there that is pushing into the left lung? That's right, the heart. So essentially we are accommodating the heart on the left side, so our left lung is significantly smaller than the right lung. So we have a superior and inferior lobe on the left side, so only two lobes. And we have that cardiac notch, essentially, to accommodate the heart. And then on the right side, we have a superior and middle and inferior lobe. So we have three lobes on the right side. And then the diaphragm, of course, we've seen the diaphragm before when we were talking about the different muscles, because it is a muscle, but we need to talk about it again in terms of the respiratory system, because it's our breathing muscle. So let's look at our model. So again, the top of the lung is going to be the apex. So it comes to a point, and then the base is going to be the bottom of the lung. Okay. So if we talk about, if we're looking at the anterior view, this is going to be the left side, this is going to be the right side, because again, remember, we're talking about the lungs as if they are our lungs, not the view that you're looking at right and left, okay, if that makes sense. Okay, so if we look at the left lung first, it's going to have this cardiac notch, right? So the heart sits over here on the left side, and so the apex of the heart, which is down here, is going to sit in that cardiac notch. Okay, and we only have two lobes, so a superior lobe and an inferior lobe. And if we talk about the right side, we add in a middle lobe. So we have a similar right superior, right inferior, and then we add in a middle lobe. Okay, so there's no middle lobe on the left side. So here's another model that kind of helps with some of the blood vessels and the bronchi. Okay, so if we look, here's our trachea coming down, and we're going to branch into our main primary bronchi. And then we're going to branch again. So all of these guys are going to be our secondary bronchi. So essentially the secondary bronchi should be going to those lobes. So we should have 3 secondary bronchi if we're looking at the right lung. Okay. So we should only have 2 secondary bronchi on the left side because we only have 2 lobes on the left. And then we're going to, anytime we branch again, essentially we're going into tertiary bronchi. Okay. And then they continue to branch, and we'll talk more about those when we talk about the respiratory system in lecture. Okay. But we can see our arteries as well. So we have our pulmonary arteries and veins. So arteries are going to be blue, veins are going to be red in the lungs, right? Because we talked about the difference between that oxygenation in the pulmonary circuit. So that was it for the respiratory system. Now let's continue on with the first part of the digestive system. So we're really going to focus on kind of the upper gastrointestinal tract or GI tract. So what are the structures we're going to learn today? So the oral cavity is going to be our opening, just like our nasal cavity for the respiratory system. The pharynx. So pharynx is going to span both the nasal cavity and the oral cavity. So essentially it's the throat structure. It's the back of the nasal cavity, back of the oral cavity, and down into the larynx. And then the esophagus is pretty much similar to the trachea. It's our tube down into the stomach, just like the trachea is the tube down into the lungs. And then we have the stomach, which is where we're going to really start mechanical and a lot of chemical digestion of the food material that we start to eat. And then it's going to continue into the first part of the small intestine, which is the duodenum or duodenum if you want to be British and remember how to spell it. That helps me out. That's why I hesitated, because I always think duodenum, but then when I look at it, it's pronounced duodenum over here. But this is really the major site of chemical digestion, and we start the absorption of nutrients in the duodenum. So the duodenum is really kind of the happening place in the digestive system. So here's our digestive system model. So we have that sagittal section up at the top of our head, and we can see the mouth and the oral cavity up here with the tongue. And then we're going to continue into the oropharynx, or that's the part of the pharynx that's in the back of the throat, the oral cavity. And then we're going to continue through the esophagus and into the stomach. The food sits in there and really gets mechanically and starts to get chemically digested, and then it comes out into the duodenum, which is really just this first section of the small intestine. But what's important is that's where our bile comes in and our pancreatic juices all dump in right here, and that's where we do all that chemical digestion of our food. We break it down into the tiny little bits of material so that we can absorb it into our bloodstream, and then it'll go to the liver via the hepatic portal system, right? When we talked about that back in our vessels, right? So then, and then next time we're going to continue through the digestive system. So we've got to get through all of the small intestine before we can finally go into the large intestine and then out the rectum and anus. Okay, so we'll finish off the digestive system next time. So let's go back to the oral cavity. So we do have some accessory digestive organs. So what does that mean? Anything that's not part of the tube of the digestive system. So anything that's going to aid in either mechanical digestion or chemical digestion. So when we're talking about the teeth and the tongue in the mouth, they're accessory organs. So they're not part of the oral cavity itself, like the walls, like the palate, things like that, but they're in the oral cavity, right? So the teeth are gonna and tongue are gonna help mechanically crush the food in the mouth, okay? Then we also have some glands. So these guys are not directly in the oral cavity, but they're around the oral cavity. And then they have tubes that are going to be going into the oral cavity, right? So we're going to have salivary glands with salivary ducts or tubes that are going to allow the saliva to get into the mouth. So we have three main salivary glands, and we've talked a little bit about the innervation of the salivary glands when we were talking about the cranial nerves, right? So some of our cranial nerves are going to have some parasympathetic innervation to these glands, right? Remember our rest and digest function of the parasympathetic innervation. So these guys are going to be innervated to produce and secrete saliva, because saliva is going to help to break down some of the food, specifically carbohydrates, in the mouth. So I don't really like this model as much. It's kind of ugly and old, but anyways, this is one of our other models, but it does show some of the salivary glands. So we have our tongue, which is here inside our oral cavity, and then our pharynx in the back. And these are the sublingual glands. So sublingual meaning below the tongue. So sublingual glands, okay? And then if we look, here's another model. This is our mandible with our teeth stuck in there. And if you see in kind of, it's on the medial side or inside of the mandible is the submandibular glands. So below mandible or kind of inside the mandible. So these are the submandibular glands. So we have sublingual below the tongue, submandibular kind of inside or below the mandible. And then if we look on the outside near that masseter muscle, so remember our masseter and temporalis coming down are two big muscles of mastication, right below that or next to that is going to be our parotid gland. This is the biggest salivary gland, kind of right in front of the ear. And that's going to be producing a lot of saliva. So that's the parotid gland. So I don't worry quite so much about the teeth in my anatomy class, but I know that I think there is a good video that he did on the teeth. So we'll talk a little bit about the teeth, but I don't really care that you know the numbers of the different types of teeth. We know we have incisors and canines, bicuspids, which are premolars and molars. So unless you go into, you know, dentistry or something like that, I don't think it's as important to know all the numbers. But I do want you to know a little bit about tooth anatomy. So what is a tooth made up of, and what are the different parts? So we have a crown, which is what you see, which is above the gum line. And then there's a root, which is below the gum line, so it's what you don't see, and that's what's stuck in those the holes of the bone. And then the root canal, which is essentially the inner part of the root. Okay, there's a little canal or a little opening, and that's where the vessels and nerves are going to run in that pulp cavity of the root canal. Okay, so let's take a look at those pictures. So again, these are the things that I don't really care that you know which is which, right? So we have some incisors, canines, and some molars. So this is the tooth anatomy, okay? So we have the crown, which is above the gum line. Don't worry so much about the neck, and then the root is below the gum line. And if we open it up, we can see that there's a root canal that's running inside the root, and it opens up down here at the bottom of the root into our nerve and blood vessels. So the nerve and blood vessels are able to come up through that pulp cavity, that root canal, and open up into the tooth. Okay, so this is again, when you have a bad tooth, you have an infection down in your root, they have to do a root canal and take out all those vessels and nerves because they're open to the environment and they're painful, and then you get a crown put on, which is essentially a fake crown that's put over like a cap on top of the tooth. Okay. So now let's talk about the esophagus and stomach. So we've left the oral cavity, we're going through the esophagus and into the stomach. And the big thing about the digestive system in general is we have some sphincters. So sphincters, think of like doorways. Once they go through the sphincter is going to close so that it can't come back up. You essentially don't want your food to go backwards, right? You want it to just go forwards through the digestive system. So there is an important sphincter at the end of the esophagus, essentially at the opening to the stomach, and that's the lower esophageal sphincter. And this is where a lot of people have trouble with this sphincter because it doesn't work quite correctly. So some of the food does come back up into the esophagus. And what happens is in the stomach, you've got a bunch of acid in the stomach that's helping to digest the food. And so that acid essentially comes up into the esophagus and you get, acid reflux or GERDS syndrome for people that get that lower esophageal sphincter just isn't quite working correctly. Because the stomach can deal with all that acid. It's built that way. It's the walls of the stomach is accommodating to the acid, but your esophagus is not. So it's essentially burning the walls of the esophagus. So once you get into the stomach, we do have some different regions of the stomach. So we'll talk about those. They'll make more sense when we actually look at the stomach itself. But essentially one big feature of the stomach are these gastric rugae or folds. So these guys allow the stomach to expand. So when you eat a large meal, your stomach is able to expand without, rupturing or exploding, even though sometimes we feel like our stomach's going to explode after we gorge ourselves after Thanksgiving dinner or whatever that may be. But it's amazing how the stomach can stretch. Okay. So let's look at those structures of the stomach. So if we look, here's the esophagus coming down, and you notice here's that esophageal sphincter, that lower esophageal sphincter that is going to close, hopefully, when that food enters the stomach. So then if we look at the different regions of the stomach, you see it's kind of, backwards C-shaped. Okay, so we have one edge that's kind of a larger curvature, so it's a greater curvature, and then we have a lesser curvature side. Okay, so it's the greater, lesser curvature of the stomach. And then we have the fundus up at the top. So fundus just kind of means an upward protrusion of an organ. So we have a fundus of the uterus as well. And then the opening into the stomach, kind of where that lower esophageal sphincter is the cardia. Okay. So the cardia is just the opening into the stomach. And then the body of the stomach is essentially just the main part. Okay, the main part of the stomach. And then once you get down here into this curve at the bottom, then we come into the pylorus. Okay, so this bottom part here is the pylorus. And then we have an exit to the stomach, right? We are going to exit the stomach into the duodenum of the small intestine. So we have yet another sphincter, another doorway that's going to close once it exits the stomach. And so we call that the pyloric sphincter. So we have an opening into the stomach and an opening out of the stomach, and each one has its own sphincter to close and open. So here's just another model of the stomach, but one thing we did forget to talk about on the last slide was the rugae. So the rugae are those folds, so you just notice how the inside of the stomach is not smooth, has all these little kind of worm-like structures, and that's just depicting those folds. So essentially it can expand quite huge after large meals. And another thing we haven't talked about, but we'll talk more about it in lecture, is the smooth muscle. So essentially the walls of the stomach is just one large muscle, actually 3 layers of muscle. So the stomach is just a big muscle pounding and squishing all the food inside there for digestion. So we'll talk more about the rest of the digestive system next time. So we'll talk more about the small intestine, the large intestine, and the rectum, and then also some more accessory organs. So we've got organs that are going to be producing all of the chemicals to help digest the food. So that's going to be the bile from the liver and gallbladder, and then all those pancreatic enzymes that are going to be digesting all of our food. So we'll talk more about all those structures and organs next time. Okay.